very often it starts little steps at a time. Like maybe, you leaked a little bit when you laughed or were having a good time with a friend. Or maybe, you're about to go to the bathroom and couldn't really hold it and had a little accident. So very often we justify it to ourselves saying that, oh, it's not a big deal. It was just once off thing, right? So the first thing I would urge your audience to understand is awareness. The fact that they're listening to today's podcast, hopefully they will already know that these things, whether it's leakage with laughing, coughing, sneezing, or not being able to make it to the bathroom, which is urgency related leakage, these are not normal symptoms.
Are you a busy woman who prioritizes everyone else's health above your own? Do you have questions about your diet, exercise, or how to prevent or treat certain health conditions? Are you always Googling health questions that you forget to ask or are embarrassed to ask your primary care physician? Girl, do you even have a primary care physician? Well, welcome to Headed to Healthier. I'm Dr. Brittany Anderson, a board-certified family medicine physician, and every day in my private practice, I have discussions with women just like you who are doing their best to juggle the demands of life while also desiring to become healthier. Inside this podcast, you'll find practical and actionable health tips that you can incorporate into your daily life. You'll get expert advice and insight from some of my awesome healthcare colleagues, and you'll hear relatable conversations with incredible women just like you who have made their health a priority and are thriving because of it. So throw on your sneakers and get some steps in while you listen. Or if you're driving, get those hands at 10 and 2 and let's dig in. We are headed to healthier. Hey ladies, welcome back to today's episode. I'm so excited today to be joined by Dr. Nabila Noor. She is a urogynecologist and reconstructive pelvic surgeon in Pennsylvania. This is a treat to have her on the show here. I know so many women deal with pelvic floor disorders or urinary issues, and they're fairly common. And we sometimes think that, oh, because it's common, because we talk about it in my ladies group or amongst my friends, then that means that it's normal. Well, just because they're common does not mean that they're normal. And so, Dr. Noor, welcome to the show. I would love for you to introduce yourself a little bit more, and then let's start talking a little bit about urinary leakage, pelvic floor disorders, all the things, if you don't mind.
Of course. Thank you so much, Dr. Anderson, for having me. Super excited for our conversation. And as you mentioned, these conditions, all these pelvic floor issues are so common, but they're absolutely not normal, which is why I'm really looking forward to kind of our conversation. A little bit about myself. I am a board-certified fellowship-trained urogynecologist and a pelvic reconstructive surgeon. My background is in obstetrics and gynecology. So after finishing my residency in obstetrics and gynecology, I decided to specialize further, which is where I did a fellowship at Harvard to train in advanced pelvic surgeries. So my practice right now, like you mentioned, is 100% urogynecology, where I take care of women with all kinds of pelvic floor disorders. But one of my other passions, both in the operating room and outside, is education. So a big part of what I do now is really being active and really being a spokesperson talking about pelvic floor issues on various social media platforms. So I have a YouTube channel, Nabila Noor MD. I just revamped it. So the new version of it is being launched on October 16th, which I'm super excited about, and also on various social media platforms, whether it's Instagram, TikTok, because I truly believe that knowledge is power. So I really do take it very seriously, making sure that I talk about pelvic floor issues, educating women no matter where they are in this world. So yeah, I'm excited to have our conversation today.
Wonderful. I'm so excited to have you here. And let me just say, your social media is goals. I mean, you are so incredible. Your YouTube channel, how active you are on Instagram, all the places. And so, ladies, if you're driving or out for a run and didn't get the name as she said them, don't worry. I'm going to tag links to her social media in the show notes for this episode. And you are not going to want to miss what she's putting out. I am a whole physician, a whole MD, and I am tuned in because I learned so much from you. And so I'm learning from you. I know that my listeners can learn so much from you as well. And so love the revamp that's coming of your YouTube channel as well. By the time this airs, it will be revamped. And so ladies, be sure to check out Dr. Noor's social media channels that are out there. All right, let's get into it. Let's first start talking about what pelvic floor disorders are. We commonly think about things like urinary leakage and things like that, but I know it's so much broader than that and so much more common, as you mentioned before. So, would you mind kind of just giving us a little bit more background so we can set the stage for our discussion?
Absolutely. And that's a great place to start is what is the pelvic floor? Because very often, we talk about pelvic floor, we talk about pelvic floor disorders, but very few women actually understand what the pelvic floor is. So the easiest way to understand what the pelvic floor is think of it as the base of your torso or the floor that's holding all your inside organs, essentially. Primarily your pelvic organs. So our pelvic organs can be the uterus, which is where a baby grows. It could be the bladder, which holds our urine, the rectum or intestines, which is where stool collects. So all these pelvic organs are being supported by our pelvic floor, which is a combination of muscles, connective tissue, ligaments. So think of it as the trampoline that's holding all these organs. So when we talk about pelvic floor dysfunction, it's because these pelvic floor muscles or the tissues and ligaments are not working the right way. Why? There's a whole host of reasons, and I know we'll get into them. But because of the pelvic floor muscles not working the right way, there can be things like urinary leakage, things like pelvic organ prolapse, where things are sagging down. Women can complain of having difficulty with urination or bowel movements, pain with intimacy, a whole host of pelvic floor issues.
Awesome. I think that's a great place to start to kind of lay that framework a little bit. Many women, now, Dr. Noor, I don't have children. I had a dog for 11 years. I loved her. Best dog ever. I treated her like she's a whole human child. But most of my friends, family members close to my age, etc., have experienced childbirth and vaginal childbirth. And many of them I hear, and my patients as well, I hear talk about urinary leakage that comes after they get older and that they start noticing, especially after childbirth. And like I said, they assume sometimes that it's normal because it is common and they talk about it in circles, or we talk about it in circles. Can you help us understand what actually is happening in the body when this occurs and women start to have this urinary leakage?
Yeah, absolutely. And that's actually one of the first times that women start noticing pelvic floor issues is during pregnancy and immediately postpartum. So what's happening is with pregnancy, as you can imagine, as the baby is growing, there's a lot of pulling and stretching that happens to those pelvic floor muscles. Remember, we talked about the pelvic floor muscles as the organ or this floor that's supporting your uterus. So as this uterus grows, when the baby is growing, that extra weight can cause a lot of pressure and stretching. Then fast forward when you're actually having a baby. So for women who are having vaginal delivery, as the baby comes out, it causes a lot of stretching and even a lot of tears and damage to those pelvic floor muscles. There are nerves there that can get damaged, and that too can cause your pelvic floor muscles to get weak. And then subsequently in the postpartum period, especially a lot of women who are breastfeeding, they go through a lot of hormonal changes. So the estrogen, which is a hormone that, usually spikes in pregnancy, when you're breastfeeding goes down significantly. And that can cause a lot of vaginal changes or tissue changes in the vaginal area, causing a lot of thinness, a lot of dryness, and that again can cause or affect your pelvic floor muscles. So everything combined, as the support of those pelvic floor muscles get weak, the support of the bladder and urethra, which is what was supported by these pelvic floor muscles, those can be affected. And as a result, women can end up with things like leaking when they're laughing, coughing, sneezing now, something that we call stress urinary incontinence, which is leakage with any kind of exertion to your abdominal wall muscles.
Yeah, so let's talk about that if you don't mind, kind of that stress urinary incontinence. So you mentioned, a woman may notice that when she laughs or coughs or even is out exercising, that she's having some small leakages, and it can be initially concerning for some, can be more annoying for others. But what are some of the first steps? So, obviously in my show and like yours, we're not giving specific medical advice to specific people, but this is something we can generally talk about. Generally, what are the first steps women can take to strengthen their pelvic floor and to kind of help with those symptoms some?
Yeah, absolutely. I think the first thing and probably the most important part of it is awareness, right? Because very often we normalize symptoms because they're not very significant symptoms in a sense that it's not cancer or it's not like a heart attack where you're like,
Yeah.
well, I have to go see a doctor.
Yeah.
Very often it starts little steps at a time. Like maybe, you leaked a little bit when you laughed or were having a good time with a friend. Or maybe, you're about to go to the bathroom and couldn't really hold it and had a little accident. So very often we justify it to ourselves saying that, oh, it's not a big deal. It was just once off thing, right? So the first thing I would urge your audience to understand is awareness. The fact that they're listening to today's podcast, hopefully they will already know that these things, whether it's leakage with laughing, coughing, sneezing, or not being able to make it to the bathroom, which is urgency related leakage, these are not normal symptoms. So some things that you can do is, first starting to get an understanding of what are your pelvic floor muscles? And it's hard, right? It's not like your biceps or your ab muscles that you can see. Our pelvic
Right.
floor muscles are inside the body. So oftentimes, we'll talk about Kegel exercises. And I have many patients or even, viewers who will say, oh, I know what Kegel exercises is. And when I actually do an exam and tell them, here, show me how you do your Kegel exercises, and I'm trying to identify their pelvic floor muscles, I realize they're not even isolating the right muscles because
Right.
it's hard. It's a muscle that's inside. So a lot of the times when we talk about Kegel exercises, these are special kinds of exercises that women can do in the comforts of their home to help strengthen their pelvic floor muscles. Now, how do you know whether or not you're doing them right? One easy trick to do is imagine you're going to the bathroom, you're in midstream, and you're trying to stop that stream. So you're kind of tightening those muscles to hold that stream. So if you can hold the stream, stop it midway, the muscles or the tissue that you're engaging to kind of close that midstream, or sorry, that close that urine flow, those are your pelvic floor muscles. Now, I don't want you to stop like, your urine stream midway. That's just to understand that those are the pelvic floor muscles that I need to work on. So when you talk about Kegel exercises, I usually tell patients, think of Kegel exercises as a three-step process. You are contracting those muscles, you're holding them, and you're also relaxing them. Now, all three steps are equally important because you just don't want to tighten those muscles and not relax them because then you just end up with sore pelvic floor muscles, which, by the way, has its whole host of problems that we could
Right.
probably cover in a whole other episode. But relaxation is just as important. And the analogy I give patients is think about when you're working out your biceps, right? If you want to build up your biceps, you're not just going to flex them all day, every day. You need to learn how to relax them. You also need to do some triceps. So it's like a yin and yang. You just want to do the contraction as well as the relaxation. So going back to our Kegel exercises, so some of the things that you can do is number one, be aware of your pelvic floor muscles. Number two, start working on those Kegel exercises to strengthen them. If you are not sure whether or not you're doing them correctly, start with maybe seeing a specialist or maybe seeing a pelvic floor physical therapist. And these are not just any therapists. These are pelvic floor physical therapists. And the reason it's important is because they have specialized training to help women understand their pelvic floor muscles, do pelvic exercises. And, I think we were talking earlier that you may be in an area where you may not have access to a provider or a specialist easily. Start with learning on the social media, right? I mean, like I said earlier, I have a whole YouTube channel dedicated just for this because I realize not everybody have availability or have access to specialized providers. So that's kind of why I created the social media platform so that even before you physically go see a specialist, you can learn so much about your body and start doing some of these simple things by yourself. And of
And
course,
that's so important. And that's so important. Sorry to interrupt you, but we were saying before in the area that I practice, there is not a urogynecologist for 2 hours. There's not even an OB gynecologist for an hour. And so you're exactly right. And that is why I think, again, I'll keep saying this, that your social media, especially your YouTube channel, is so gold because you're teaching these things. And as our listeners can tell already, you put it in a way that we can easily understand it. So sorry, I know I interrupted you, but just
no,
wanted to
not at all.
say
And I'm
that because
glad
I
that you
love the point.
mentioned it because oftentimes, I do hear it from women that, oh, I don't have a urogynecologist in my area. I don't have a pelvic floor physical therapist. And I completely get it, right? But the truth is, there's so much that you can do
Yes.
just by being aware about your body, learning about your pelvic floor. And truth be told, there are, you know it, you and I both know it, there are people in the healthcare field who don't even know that
Yeah.
this whole specialty of urogynecology is
Right.
there. because it's such a new specialty and we're learning, we're developing, which is also why it's so exciting to be in this field because there are new therapies coming out and not everything is surgery. I think
Right.
oftentimes when people see my title, they see a surgeon and in their mind, they're like, oh God, she wants to do surgery. I don't want surgery. I don't want to be anywhere near her. And that could not be further from the truth.
That's right. You want to be near Dr. Noor. She is the doc that you want to see if you're having these issues, especially if you're in the Pennsylvania area. Am I right? You're in around Allentown?
Absolutely. I'm in Eastern Pennsylvania, like in the Lehigh Valley area. But again, I truly do believe the beauty of my specialty is it's a quality of life issue. And what that means by that, and what I mean by that is that there's no one size fits all. It's not cancer that you have to have surgery. It's a quality of life, and every patient gets to dictate what that means for them. For some women, it just means, hey, Dr. Noor, I just wanted to know I'm not dying, and I just want to know what I can do to prevent it from getting worse, and that's where I want to live, and that's absolutely okay. And then I have patients who come to my office and are like, you know what, sign me up for surgery yesterday, and we are signing them up for surgery. So the beauty of what I do is that it's all quality of life. There's so many options, starting from lifestyle choices, conservative measures, and of course, surgery for the patient who wants something more definitive. And there's no right or wrong. There's no pressure. It's a conversation that we have and then come up with a plan that works for each individual patient.
Right. I love that. And I know that patients appreciate you individualizing their care. And so first steps. So first steps for women who are having these symptoms, the leakage with coughing, laughing, exercise. I hear you saying hands down, it's key. One, it's awareness, right? Knowing what you've got going on, but then thinking about Kegel exercises. Anything else
Yeah,
that you think to
absolutely.
that?
Yeah, so Kegel exercises, but I would also add a big component is being aware of what are the risk factors and avoiding
Oh,
them, right?
yes.
So what do I mean by that? So the main issue here is anything that puts pressure on your pelvic floor can cause it to get weak, right? So of course you can't avoid pregnancy because if you want to have children, you have to be pregnant. But think about constipation. So patients who are chronically constipated, or my patients who have chronic cough. So whether it's the COPD or the asthma exacerbation, people who are being overweight. So imagine anything that puts constant pressure on that pelvic floor will make you more susceptible to developing these pelvic floor issues. So if you're somebody who's constipated, make sure you're upping your fibers, 30 to 35 grams of fibers every day. Make sure you're drinking your water. If you're, coughing or having chronic constipation, or sorry, chronic cough, make sure whether it's asthma or COPD, you're addressing it. If you're a smoker, maybe time to think about cutting
Stop.
that down. Yes, because not only does the smoking exacerbate your cough, but the actual smoke can affect your connective tissue, which in turn can weaken the pelvic floor. And of course, as we all know, obesity can cause so many problems. But there's actually good data in my world which shows that even if you lose as low as 8% of your current body weight, and just by lifestyle changes or basic exercises, that can significantly improve your urinary symptoms. So
Oh,
there's
wow.
so much you can do even before we're talking about surgery.
Wow, that's really good to know. That's good information. Now, sometimes I mentioned that women will talk about these kinds of things in circles, but also sometimes women just keep it to themselves and, not just keep it to themselves away from their friends, but even they don't share it with me in my office, or maybe they don't share it with their OB-GYN in their office. Would you speak just a little bit to that and how women could perhaps feel just a little bit more comfortable bringing this up with their primary care doc or with their OB-GYN? Or getting to making that step of saying, all right, let's go see, a specialist, a urogynecologist, to talk about this.
So, no, I absolutely get it, right? I mean, everything we talked about, whether it's urinary leakage, bowel issues, pelvic floor issues, these are embarrassing things to talk about. And oftentimes when patients are coming to see their primary care doctor, there's so many things they have to cover. Their diabetes, their heart problem, their GI problem, and oftentimes leaking urine just doesn't seem that important.
Right.
But one thing I hope to emphasize to you is that just like you would talk to your doctor about your brain, about your heart, about your gut, take the time to talk about your bladder. And sometimes it can just be a simple language. You may not know what condition you have, but you can bring it up as something like, hey, Dr. Anderson, I noticed that, when I laughed or coughed, I had a little bit of leakage. Is that normal? Is this something I should be concerned about? Do you think I need to see a specialist, or are there options that I could do? And then that opens up a whole conversation where your doctor can now ask you more specific questions. I mean, you see it in your world. I obviously they see it in my world, but there's so many variations of urinary leakage. But once you as the patient kind of bring it up, exactly the symptoms that you are seeing or you're feeling in simple words, we can kind of help individualize it or kind of narrow it down to the exact specific issue and then get you the help that you need.
Absolutely. So, women, please feel free to share these things with your doc. These are things that we want to know. I've started, really trying to reframe my physical exam, my question asking to get to so many things that I'm learning. Hey, this has been going on for a year now. Why am I just hearing about it? And sometimes that's on us as the physician that we don't ask those leading questions. But I'd encourage you all not to just leave it at your physician, to go in there, think about it. One of the things that I share with my audience often, Dr. Noor, is to start making a list of things between your appointment. And now, if you go in, there are 30 things on that list. You may not, in an insurance-based practice, you may not be able to get to all 30 of those things. But really, don't take for granted those things that are happening regularly and frequently. Don't move those things far further down on the list. Make sure that those are things that you address with your doc. You and I both hear and see some wild things every day, all day. Urinary leakage, bladder issues, etc. Nowhere near the top of the list of the wild things that we hear. So I want my listeners to really feel comfortable talking with their docs about these things.
Yeah, and I think, one thing I would also like to add to that, Dr. Anderson, is that, if it ever gets to a point, now, if you had a leakage of urine because you had a full bladder, you did empty your bladder for maybe like a good few hours, once in a while, fine, totally understandable. But if it's starting to become regular, where now you're worried, oh my God, I don't want to go outside because what if I have an accident? Or you're starting to wear a panty liner because you're worried that you're going to stain your underwear, or you're avoiding social gatherings or avoiding, hanging out with friends or having a drink at a party because you know something bad is going to happen. When you start seeing that repetitive pattern and you're starting to notice that you're modifying your life or avoiding things, avoiding exercises, avoiding hanging out with friends, things that you used to enjoy, and it's affecting your quality of life, that's a time to realize that, okay, I need to bring it up with my doctor.
Would you mind sharing with us just some of the latest or more effective treatment options that you use in your practice, whether these are lifestyle changes or procedures, just things that women can have in the back of their mind? So if they do bring this up with their primary care doc or their OB-GYN, or they go to see a urogynecologist, just so they can kind of already have in their mind what types of options may be put on the table for them.
Yeah, no, this is my favorite question of the day, right? Because this is what I do all day, every day. We already kind of talked about avoiding risk factors. That's a big one, and I think often overlooked. But avoiding the risk factors is such a simple thing, and kind of focusing on that prevention, which I know you want to focus on as a primary care doctor as
Right.
well. And then talking about more treatment options, depending on what kind of urinary leakage you're having, whether it's stress urinary incontinence, which is leakage with laughing, coughing, sneezing, versus the urgency related leakage. There are medication options. There are things like pessary, which is a vaginal insert that
Mhm.
sometimes we can place that can help support the bladder and the urethra. And then, of course, pelvic floor physical therapy, we talked about doing it in a more guided form, in a more structured form. And of course, for the patient who wants more definitive option, we have these minimally invasive surgical procedures. And what I mean by minimally invasive surgical procedures is that these are 10 to 15-minute procedures. Some of them we can do even in the office, things like urethral bulking injections for women with stress incontinence. There are sling procedures, which you may have heard about for incontinence as well. But these are small procedures. They're often done with sedation. Patients go home the same day. And truthfully, the success rates are amazing. For
Wow, that's
patients who have
fantastic.
overactive bladder, we have things like Botox that we can inject into the bladder, sacral neuromodulation. Again, all sounds complicated, but they're really minimally invasive procedures that we can do in 10 to 15 minutes. Patients go home the same day, really not much downtime, but significantly improves patients' quality of life.
I love that you brought up Botox. I was talking with a patient last week and I was like, Botox is not just for your face. There's
Oh,
so many other.
absolutely. I just made a video about that,
Oh,
actually.
did you? Oh my
Yes.
goodness, I missed that one. Well, that is wonderful. And let's talk about that. So you just made a video about that. Would you share, if you don't mind, just some other topics that you address on your social media, your YouTube channels? Because we are all heading to it. If you're listening on the day that it airs, it's October 22nd. And so Dr. Noor has already dropped her new YouTube channel. channel. What types of things do you discuss on your channel?
Absolutely. So before October 16, my YouTube channel was Dr. Nabila Noor. So there I actually made educational videos both in English and in Bengali. So I'm Bangladeshi American, so Bengali is my native language. So I used to make videos in two different languages. But as my viewers and subscribers list increased, I realized I want to separate my English videos and my Bengali videos just to kind of cater to my two different population. So the new updated YouTube channel, which is Nabila Noor MD, will be primarily for my English speaking subscribers. And here we're going to talk about everything about pelvic floor, urinary leakage, pelvic organ prolapse, bowel issues, treatment, when to get surgery, when you shouldn't, what are some things you should be looking forward to. And of course, I'm building that. So there's going to be 2 videos every week, and I'm continuing to post. If you want to look at some of the videos that's already there, which is in my current channel, Dr. Nabila Noor, please feel free to check them out. There are tons of videos already over there about all these different things. So I think together you'll see that, it's going to be very comprehensive and really give you the bread and butter of urogynecology and actually a lot of things that you want to learn about before you even have to go see a specialist.
Right, absolutely. And again, ladies, don't worry, I'm tagging links to all of her social media in the show notes. I know that you are so active there, and I really am so grateful to you for providing so much information. You may think that you're just doing it for the general population, but I promise you, you are doing it for physicians as well, especially those of us who, like I said before, don't have quick access to urogynecology in our area. And so, Dr. Nabila Noor, thank you so much for joining today. I'm going to give you final word. Is there anything else that you'd like to say in closing? Tell us maybe just a little bit more about your practice and any closing words that you have.
Yeah, I mean, first of all, thank you so much for shedding light on this really important topic. And I think, pelvic health, like we discussed earlier, often gets kind of put in the background. But thankfully, women's health is coming in the limelight. We're talking about menopause, which is, again, a whole host of topic that I cover. There's so many issues that oftentimes women were told that, you just have to deal with it. And I think, if there's one thing I want to tell your audience today is that you don't have to live in pain. You don't have to just accept what maybe your grandmothers or even our mothers accepted as normal part of aging or what we were told was normal part of aging. In today's day and age, in 2025, we have a whole specialty that's dedicated to taking care of women suffering with pelvic floor issues, which covers a whole host of things, a lot of which we talked about, a lot of which we didn't, whether it's pregnancy-related issues, childbirth-related trauma, perimenopause, menopausal issues. And I take care of a whole host of women, ages ranging from their early 20s to all the way to the 90s. I think my eldest patient that I saw was a 96-year-old. So there's a whole range of population that I take care of. And all these women have different issues that affects them at different stages of life. And thankfully, like I said, in 2025, we are shedding light on that. So absolutely no reason for you to suffer in pain, to suffer in discomfort, to suffer in embarrassment, really. I do want women to understand that dignity of life is really important. And it just doesn't have to be that, when your condition is really, really bad, that's when you seek help.
Right.
A lot of it can start with just understanding your body, understanding so that you can feel confident in your own skin and not question whether or not something is normal or not.
Absolutely. Thank you so much, Dr. Noor, for joining us today. Ladies, go check out her social media, her new YouTube channel that's launching. Again, the links will be in the show notes. Dr. Nabila Noor, thank you again. I wish you all the best in everything that you do. Thanks for joining.
Thank you so much, Dr. Anderson. My pleasure.
Hey, thanks for listening in today. I hope something you heard in this episode will help you on your journey to becoming healthier. Remember, this podcast offers general health information. I am not your personal physician. If you need advice that is specific to you, be sure to consult your physician. If you enjoy this podcast, please consider sharing it with a friend and reviewing it on Apple Podcasts. Also, be sure to subscribe to the show so you never miss an episode. Tune in next week for another great episode of Headed to Healthier. Until then, take care of yourself. Talk soon. Bye.